It is 17 minutes after 12 o'clock. Have you been drinking more alcohol during the pandemic? I know it's kind of a personal question. One that came up during the first lockdown, and now that restrictions are tightening again, certainly our buying patterns have changed. Liquor stores in parts of the Maritimes have seen their sales jump. Part of that is because fewer people are drinking at bars. And in Nova Scotia, for example, while there were fewer transactions, the average amount of money spent per transaction at NSLC liquor stores has been up as people make fewer trips. Well, today we're asking, what have you noticed about people's alcohol consumption during the pandemic? Is it something we need to address? If so, how? We'd love to hear from you. Our number is 1-800-565-1940, and our email is marnoon@cbc.ca. We're also on Twitter at CBC Maritime Noon. My first guest on the phone in today is Dr. Simon Sherry. He is a clinical psychologist in Halifax, also a professor in the Department of Psychology and Neuroscience at Dalhousie University. Welcome back to the show, Dr. Sherry.
Good afternoon, Bob.
Certainly, anecdotally, you hear more people talk about drinking more in these past months. You've been involved in research about alcohol consumption and the pandemic. What are you finding?
When we looked at Nova Scotians during the pandemic, we did see an increase both in the consumption of alcohol and in the use of cannabis. When it comes to alcohol, Nova Scotians were telling us that they were drinking more frequently and that they were drinking larger amounts of alcohol. And when you look to the cannabis side of things, Nova Scotians were telling us that they had about a 20% increase in the amount of cannabis they were using, especially during the lockdown phase of the pandemic.
Okay, and when it comes to the drinking side of that, why might they be drinking more? Why are they drinking more, I guess?
First of all, I do think it's important to note that when you look at pandemic-related drinking, some Canadians are telling us they're drinking more, some are saying they're drinking less, and the majority are saying they're drinking about the same. So it's a mixed bag. In terms of those who are drinking more, the pandemic is a very stressful time. It induces anxiety. It creates depression. There's financial stress. There's a lot of isolation. There's boredom and uncertainty. Mental health problems abound. And if you're someone who drinks to cope with stress, anxiety, depression, and the like, it's very possible that you're drinking more to cope with pandemic-related distress.
Does the way our schedules are operating, at least for some people now, given restrictions, also play a role here? I mean, just blurring what our daily and weekly routines are.
That's right. We've collapsed the boundary for many people between weekday and weekend, and work and life have never been blurrier if you're in a work-from-home situation. And that does take us away from our usual anchors and routines, and that can promote increased drinking. I think also this pandemic has made it harder to access usual ways to unwind, to relax, and to de-stress. So it's harder to cope or to find fun and indulgence or pleasure that doesn't involve alcohol. You can't, for example, go to a concert, or at least not one without a lot of restrictions surrounding it.
What do you think of what I was just mentioning there about the transactions at the liquor store, certainly in Nova Scotia, and it might be similar in other parts of the Maritimes as well, where the average amount of money that's spent per transaction or per visit to these stores has been up, but fewer people are making fewer trips. Does that signal to you perhaps a change in behavior potentially as well?
This pandemic is changing consumer behavior when it comes to alcohol. People are buying alcohol at a lower markup. For example, they're going to the NSLC to drink more often than to the bicycle thief. Another trend that you're seeing is that rather than buying a bottle of wine, people are buying a box of wine. And in the early days of this pandemic, this was a sort of hoarding behavior or panic-driven purchase I should also point out, though, that alcohol purchased doesn't necessarily equate to alcohol consumed. Mm-hmm. And even if a bottle's open, it doesn't mean that it's finished.
Mm-hmm. Yeah, and so we're looking to get our listeners' thoughts on all of this as well today, and perhaps that'll be something more we explore in the time that we have left. But wherever you are in the Maritimes, there certainly seems to have been this growth in the number of alcohol producers and distributors offering up home delivery of alcohol to our homes. What impact does that have, or how do you think about that impact on our drinking habits?
I have major concerns about home delivery. If you make alcohol more available within the region where you make alcohol more available, there are more problems. And in this particular case, we're talking about bringing alcohol into homes. One thing that the Liberal government did in the middle of the pandemic is that without any debate or discussion, they made it so you could pair alcohol with the home delivery of food. Along the same lines, over the last month, you can see that the NSLC is piloting and doing research on what it would be like to deliver alcohol to homes. And keep in mind that when you deliver alcohol to homes, there are certain risks associated with that. These aren't risks for somebody who's going to have a glass of wine. But if you drink excessively, if you drink in a hazardous way, there's risks of child abuse and risks of domestic violence, and also a real risk that parents will be modeling risky drinking behaviors for their children within the home. And really what you're seeing is the alcohol industry is adapting with less drinking occurring on premises at a place like a restaurant or a bar. They're figuring out a way to deliver alcohol and profits to people within their homes under these shelter-in-place conditions.
And I know you have to protect patient confidentiality, but generally speaking, what have you been seeing in your patients during the pandemic when it comes to their alcohol use?
I think that there are a lot of ways that this pandemic is making alcohol a real problem. It's a risky time period when it comes to relapsing from sobriety to problem drinking. I would say that in general, I would be seeing an increase in the consumption of alcohol. Keep in mind that I'm generally going to be helping people who have mental health challenges, who may be turning to alcohol to cope. You also see more people who are transitioning from being what you'd call an at-risk drinker, someone who is drinking in an unhealthy way, turning into someone who has a full-blown alcohol use disorder. Mm-hmm. And so this is a very risky time to be a drinker, and at the same time, you've got people who are having more difficulty accessing services. And COVID-19 certainly exposes cracks, including cracks in healthcare systems, and you're seeing that Nova Scotia just isn't up to the task to deliver services to those in need when it comes to alcohol and other addictions.
So if you are talking to somebody who at least recognizes that there's this creep happening, in their drinking levels, that they're going up since the pandemic, what advice do you have for people who find themselves in that situation?
Well, first of all, doing something's a lot better than doing nothing. And if somebody is at a state where motivationally there's a green light, they're ready to rock, and they want to make some changes, I would want them to know that there's a range of options. There are medications that help. There are grassroots programs that are very effective, like AA, and there are supports from psychologists, psychiatrists, social workers, where we can deliver interventions that greatly increase the probability of someone drinking less, if that's their goal, or getting sober and staying sober. So I'd want people to appreciate that there is help on the way. For more of a DIY perspective, if you want to handle this on your own, and I know that that can be a legitimate way to approach this, I'd say take a look at limiting the availability of alcohol in your life. If you've got a wine cellar and a stacked bar, it's often hard to take a behavior like drinking that's out of control and bring it back into control when alcohol is readily available. I think it's also really important that people understand that not all situations are created equally when it comes to drinking, that some situations are riskier than others, and what you need to learn is how to manage your high-risk situations. How do you generate a roadmap that steers you through an interaction like a Christmas party where alcohol is almost inevitably going to be involved. So you have to get one step ahead of the situations that are likely to send you into drinking again or drinking in an unhealthy way.
And we're talking primarily about drinking on the phone in today, but you did raise cannabis there, and I think you said there's been a 20% increase in the amount of cannabis?
That is what our research shows, and I should definitely be clear to credit my colleague, Dr. Sherry Stewart, and our graduate student, Sarah Bartel, who were instrumental in leading that research. And we are seeing an uptick in cannabis consumption. And what was interesting about our research is those people who were more adherent to and dedicated to sheltering in place, isolating themselves and staying at home, actually experienced more cannabis consumption. And we see this consistently in mental health research that, although obviously very well-intentioned, our efforts to mitigate COVID-19 through isolation or social distancing are actually, in a sense, backfiring in that they're creating mental health problems and the consumption of cannabis and alcohol in unhealthy ways. Obviously, we still need to lean heavily on those strategies, and I'm not trying to undermine public health guidance, but it is very important to recognize that as we try and contain this virus, at the same time we're creating an awful lot of mental health problems, including issues around alcohol and cannabis.
And you do spell out, you and your colleagues in that research about cannabis, a number of reasons why that 20% increase in use is troubling. And one of them is the fact that in many of the cases, the cannabis is consumed through smoking.
That's right. This is a pandemic involving an infectious respiratory illness. And as this pandemic unfolds, we're learning more and more that putting burned plant matter in your lungs when you smoke cannabis seems to set you up to be more susceptible to COVID-19 and especially severe forms of COVID-19. So you have to be careful that in using cannabis to cope, you're not actually undermining the health of your lungs and your body's immune system.
Okay, well, how then, or should, or could these findings then shape the public health response to COVID-19?
I think we have to realize that prior to the onset of this pandemic, your average Nova Scotian had poor mental health. And that is to say that going into this pandemic, many Nova Scotians were already telling us they were stressed, anxious, or depressed. And since that time, all of the strain and uncertainty and ugliness of this pandemic has only made mental health challenges worse. And so our government needs to recognize both provincially and federally that we need to allocate more resources to mental health. There's a massive burden of disease associated with mental health, but we don't spend health dollars in proportion to that burden.
Just when it comes to messaging around alcohol use, for example, are you seeing at least, the warnings being put out there that we know this is a difficult time for you? A lot of you are socially isolated. This can lead to increased substance use?
I don't think that our government is very effective at disseminating that message. Our government profits in many ways from the sale of cannabis and alcohol. You see in particular in our province that there's a casual attitude from the NSLC regarding the sale of cannabis front and center. You don't see that cannabis is linked to psychosis, depression, suicidal behaviors, anxiety, addiction, or cognitive problems. Rather, the messaging you get when you step into the store is that cannabis is a way to relax, unwind, or enhance your experience. And that messaging is convenient and profitable for our province, and in part explains why we have the highest rates of cannabis consumption in the province and really in the world.
All right, well, we're talking about alcohol consumption, and as you can hear, we're touching on cannabis as well. During the pandemic that we've been experiencing, we'd love to hear your thoughts on this around, the public health direction that we should be taking, the messaging and the rest. What are you noticing among the people you are around and their consumption. 1-800-565-1940 is the number. Our email is marnoon@cbc.ca. We're going to get to your comments in just a moment. But first, Sandy Smith is standing by. He has a look at the latest news headlines. Hi, Sandy.
Hi, Bob. PEI is the first Atlantic province with a daily update on COVID-19 today with no new cases. The Nova Scotia government has not waited for its planned briefing this afternoon to tell anyone who's been in a restaurant or bar in the Halifax region in the last 2 weeks after 10 o'clock at night to go get a COVID test. And power crews in the region are busy. NB Power now has more than 4,300 customers out of the Edmundston area, 4,600 and change in total across the province. There are also smaller outages on PEI and in Nova Scotia. Details at 1 o'clock, Bob.
Thanks very much, Sandy. 1-800-565-1940. We're asking, what have you noticed about people's alcohol consumption during the pandemic? Is it something we need to address? And if so, how? My guest is clinical psychologist Dr. Simon Sherry. Let's bring somebody else into the conversation right now. Renee Ross is in the Amherst area of Nova Scotia, and she's on the line. Hi, Renee.
Hi, Bob.
Hi. What's your relationship been with alcohol during the pandemic?
It's complicated. In short, during the pandemic, it's been noteworthy that it's been a bit of a struggle. I'm an alcoholic. I've struggled with alcohol dependency since I was 19 years old, so most of my adult life, and I'm in recovery now. I've been sober for 6 years. And I was what folks would consider a high-functioning alcoholic. My drinking was mostly solo. I was mostly by myself, and it was sustained. And something that I've heard a lot during the show so far is, and I think you said it, Bob, about it creeping up on you, right? And that really can be the case. And I feel like that. As the doctor said, everybody's situations are unique. For me, I don't have a traumatic childhood. I had a wonderful, happy childhood growing up in Spring Hill. I'm still not sure as to why this has kind of been the path that I've been placed on, these struggles with alcohol. But there it is. But there's definitely been aspects of COVID that, and as we work through this pandemic, I am concerned with our with alcohol dependency and with the and ensuring that there's supports available for people in the province.
What are you seeing among the people that either you see casually or know about, and what their consumption levels have been like, or are their perception and approach to alcohol during all of these difficult times?
I think that it really does depend on the. I think that it depends on the person. Something that I found particularly triggering around COVID is the isolation, right? So the isolation and being by yourself. I was a solo drinker. That can be really, really tough. And it's also really tough, too, when there is those additional stresses and those additional triggers or anxieties that are going on in and around your life. And I do consider COVID to be very traumatic for a lot of people. And, of course, even like being isolated from our family and from our friends and not being able to have that support, or going to like a concert or going to the gym and burning off some stress, right? These just aren't options that were available before. So it's really interesting because when all of this hit, like I haven't been in a liquor store. Let's all knock on wood, right? Like that I work daily with my sobriety. Going into an NSLC is the last thing on my mind. It's like the doctor said, you want to avoid it. You don't want to be around it. I'm always avert your eyes. Right? Don't look over in that direction when we're walking through and there's some wine or a box of wine up on the shelf. But what's interesting is that when everything started to shut down back in March, I don't know if it's muscle memory or what it is, there's this sense of panic that came over me as to, oh my goodness, what if they shut down all of the all of the Nova Scotia liquor commissions? What if they shut down the liquor stores? And at first I was kind of surprised at myself. I'm like, why am I thinking of that. Like, I have no plans on going, and I'm really good at where I feel like I'm really good and strong at where I'm at in my recovery. But number one, it is kind of like that memory where you're always looking for that supply. I think that the issue of home delivery and of keeping the stores is complicated. For most people, for many people it might not be an issue, but for some, if you don't have that alcohol, right? Folks, if you are really struggling and if you're really dependent on alcohol, you are going to find that somewhere. I have drank my fair share of $5 boons and moonshine that made me sick, right? That was not good. That was not good for me, but I was very dependent. And another thing too, what I learned was, like, quitting was the best thing that I have done in my life. The best thing that I've done for me and for my daughter and for my family. A whole new person. It's just been absolutely amazing. But what I didn't know was, so quitting was, I had to do that. But what I didn't know and didn't learn till later was that how I quit was very dangerous, because I went cold turkey. And so I didn't know that medically, because my body had become so dependent on it over time, that just quitting and quitting cold turkey could also induce seizures in some folks, right? So I think that it's really important for folks to be very, very, be realistic with yourself, but also be very kind with yourself as well. And for us to know, too, that there's so much shame and there's so much stigma around alcohol and alcohol dependency as well. That is a piece of this, too.
Let's bring Dr. Sherry back in. Renee made a lot of different points there, Dr. Sherry. One of them being, be realistic with yourself, and also warning against going cold turkey.
Absolutely. Many great points there, Renee. And the one I want to highlight before I add a few comments is 6 years sober is damned impressive. Good for you. Love to hear it.
Thank you.
That caution about withdrawal is very well founded. Let me put my remarks in context. As of yesterday, we'd lost 11,521 Canadians from COVID-19. That's an enormous and a stomach-turning loss. In 2017, in Canada, which is our most recent estimate, we lost 18,320 Canadians from alcohol-attributable deaths. So people die in Canada every year due to alcohol. And there are various ways in which they'll die from alcohol, including accidents and cancers. But it's also very important to realize that there's about 105,000 hospital admissions each year in Canada due to alcohol. And a large percentage of those, maybe 20, 25%, are going to be linked to withdrawal. And withdrawal is a very serious problem, especially the first couple of days of withdrawal. The effects can be as severe as death. Seizures were mentioned. You can have hallucinations. You can get dizzy. You can become sick. So if you're going to abruptly discontinue alcohol and you're physiologically dependent on it, it's a good idea to reach out to help and to plan ahead to take a medication to help you safely transition off alcohol. And if you ever do go into withdrawal, don't hesitate to access emergency resources, because that is a serious problem.
Renee, we were talking just before we got you on the line there that, there's been efforts to make alcohol more available. Lots of independent producers and distributors offering to deliver alcohol to your home. And I know Leo Glavine, the Minister of Health in Nova Scotia, recently expressing some concern about Nova Scotia Liquor Corporation's hopes to make home delivery of alcohol part of their plan going forward. He was worried that giving access could lead to higher levels of consumption. How do you feel about that? The availability of it. Does it play a role?
I think it's very complicated, and I don't envy the minister and his staff as they work through these policies, right? Because, like I said, my first thought when I had heard about this was that panic, right? Was to ensure that folks would have a clean supply. There's the dangers around withdrawal, as the doctor was just talking about. There's the issues as well, like of having you don't want folks on some folks on the road, right? If they're really deep into their dependence, and if people don't have that clean supply of alcohol, right? Then I would think, and again, I am not a doctor. I am speaking today from my personal experience, but it's not that easy. I wish it was that easy. Or else I would have a lot more than 6 years sober in, right? Where it's like, oh, well, it's not here, so I just don't think I want it anymore, right? So I think that those are some considerations that we need to think of, especially for those folks in the province that have that the dependency or that risk of being dependent, right? So I don't think it's that easy as just saying like we don't it's not here, so it's not on anybody's mind, so it's not an issue anymore, right?
I want to get you to react, Renee, to a comment that I saw on Facebook in relation to today's show, and I'll get Dr. Sherry to come in after you. Candace wrote, I see people joking about how they got their boxes of isolation wine and liquor for this second wave, but I just cry a little inside knowing the slippery slope that can come. How do you react when you see or hear people, stocking up for a possible lockdown?
Yeah, I saw that comment last night, actually, on your folks' Facebook page, and sadly, I can relate. So, like I mentioned earlier, there's a lot of shame and stigma, and even folks who are like and who don't struggle, who say, and my mom. I remember my mom used to say to me, Renee, like, just I don't understand it. Like, I'm trying to understand like why I can have just a couple of drinks and I just stop, but you can't, right? I'm like, so trying to figure these things out, trying to address like the shame and the stigma, and even like the trope, right? Like what society thinks is the definition of an alcoholic, like, right? Like, what is that person? Is that a person that's homeless and on the side of the road, or is it really like anybody and everybody, could be anybody in the population, which it is, right? So I think that we need to be aware of that, and we also need to be aware too of the fact that we don't know what other people are going through. And the shame and the stigma is real. I mean, this is my first time ever speaking publicly about this issue. And for those who don't know, I run the Sexual Health Center here in Cumberland County. I'm no stranger to dealing with issues that that may have a lot of stigma attached to them. But it is very much, very, very much real, the shame and the stigma around alcohol dependency, around the definition of what is an alcoholic, who is that, and of course, then the need for resources and supports are so important, because there are a lot of people, I was for many, many years, who are struggling in isolation, and not only will they find it hard to come out and talk to service providers and folks that may even have a hard time coming out to talk to family members or even themselves.
Well, Dr. Sherry, let's bring you in there, because I do want you to respond first, if you would, to some of those comments that certainly some people would consider kind of flippant, first of all, whether it's, isolation wine or liquor, and what that speaks to as far as, I guess, our culture goes, but also to Renee's point about the level of services, because we want to get to that point as well here today.
Well, there's a problem here in Nova Scotia in that we have a very high density of alcohol outlets. And so alcohol is readily available in various ways through NSLCs, bars, and restaurants. And one thing that's both optimistic and interesting is during the lockdown phases of the pandemic, in regions where they started to place some restrictions on the physical availability of alcohol, like not selling it in bars or restricted hours on places like the NSLC, in those regions, drinking levels went down. And that was established in places like Australia, where they did an analysis of wastewater. So I think what we do here in Nova Scotia is often quite unfair to the person who has a drinking problem. We say it's your choice, you are responsible, you do this drinking because of how you think and how you feel and how you behave. But we forget that we've set up our culture here in Nova Scotia so that the majority of our population is within only a matter of minutes of an NSLC alcohol outlet, and it makes it very difficult, therefore, to maintain sobriety. And that's how I think you get people who have too much alcohol in their possession, and it makes it very difficult for them to then control themselves. I also think that people need to think about what sort of a drinker they are in terms of their personality, what motivates them to drink, and the context within which they drink. And when you understand what kind of a drinker you are, it's often easier to stop. For example, some people are solitary drinkers, some people are social drinkers. If you're a social drinker in this pandemic, you may drink less because people are less available socially. If your motivation is to drink to cope, to deal with stress, anxiety, or depression, this pandemic may be very difficult for you in that there's a lot of distress to deal with. And your personality also factors quite heavily into the type of drinker you are, where some people drink because they're impulsive, other people drink because they're always seeking sensations and looking to change their experience and to enhance it. So you have to understand what kind of drinker you are. In terms of evidence and supports, for people who cold turkey it and go on their own, there's about a 10% chance they're going to make it to a year of sobriety. If you add in available evidence and treatment and apply what we know to help people who are drinking, those numbers go up to about 30 or 40%. So we should absolutely be increasing the odds of Nova Scotians who want to stop drinking by delivering to them evidence-based services, and that just doesn't happen often enough in our province, and it certainly doesn't happen in a timely manner.
All right. Well, we're asking, what have you noticed about people's alcohol consumption during the pandemic? The number is 1-800-565-1940. Let's jump to the phone lines again. Leanne Richardson is on the line from Dartmouth. Hi, Leanne.
Hi, how are you guys doing?
We're doing okay. What have you noticed about people's consumption during the pandemic?
Yeah, it's definitely gone up from the numbers that I'm seeing. But then I also do have a little bit of a different vantage point because with Sober City, I host weekly Zoom meetups where, different people from the community who are newly sober or who have been sober for a long time, we all get together every Sunday and chat for about an hour. And so from my vantage point, I see a lot of people who are in recovery or who are newly sober. Mm-hmm. And so I see from their perspective, how grateful they are that they're sober during the pandemic, because I couldn't imagine, being in active addiction during the pandemic, during isolation, lack of schedule, stress, all that kind of stuff. So sure, yeah, the number's going up, but there's a lot of us out here that are sober.
And I'm very impressed with Sober City. I've read about it online, and I think it's very important because you need a series of social supports. You need a team, a network backing you up in achieving and then maintaining abstinence. Unfortunately, through advertising and just the way we live here in Nova Scotia, factors are always chipping away at your sobriety. So to have support from a group of people who care about you and maintaining abstinence, I think is vital to helping people stay healthy and stay sober.
I agree, and thank you for that. And I mean, that's why I created Sober City, because I felt like there was something missing here. Support is number one. That's what helped me get to 6.5 years sober today. Was support, the support system that I created for myself. With friends, with therapists, with group therapy, all that kind of stuff. So Sober City, that I think is the social aspect. Meet other people in your community who are 3 months sober. Meet other people in your community who have been through relapses and know what it's like to be a year sober, things like that. So it's very helpful from what I'm seeing in my Sober City community.
Kathy Redden-Thomas has jumped in on the conversation as well on Facebook, and she says, listening to your show and hearing them talk about the help that is out there for alcoholism, she says it costs $9,000 to go to Crosby House here in the Annapolis Valley. Most people just can't afford the treatment that they need. So, Leanne, those conversations obviously very important to have among people who are looking for the help, to try to help them through and build that network like you did in your case. As we get into the Christmas season and people, get out and about more and more, are you finding that people are finding that plus the pandemic, that those are sort of two challenges hitting them at the same time?
Yes, definitely. And I asked that of the group this past Sunday. I said, it's coming. It's about a month away. Like, how is everyone feeling? And I know, it's a mixture of like, I'm so relieved. I don't have to go to the usual big family gathering where everyone's drinking. But then there's the other side of, okay, wait, I'm going to be home by myself. I'll be isolated. And so it's a mixture of the two. But I think everyone is sort of on the edge of their seats and apprehensive as to what's about to happen within the next month, really.
We're talking on a day where restaurants and bars are curtailing their hours and perhaps closing in some locations because of COVID-19 numbers. But you also have some thoughts on how, even in regular times, restaurants and bars could, I suppose, in a way, meet you halfway here in this challenge that you face.
Yes. Well, I know... I did actually look at all of the menus in every bar, every restaurant in HRM and really study them from the perspective of someone who, say, just quit drinking and they're going out with their friends and want to, be social, but everyone else is drinking. So on that menu, is there non-alcoholic options? A lot of the times, no, there isn't. We have to rely on the server to verbally list off the top of their head all the options they have for non-alcoholic. So I made a guide, I guess, on my website that shows what places have different mocktails, what places have kombucha on tap, say, things like that. But I think a lot of restaurants that innocently they just don't think about that. They don't think to add non-alcoholic options on their menus, and that's one thing I'm working to hopefully change in the future. Is we exist, us people who don't drink, we exist, and there's a lot of us in this city. So there's ways that you could appeal to us as well at different bars and restaurants.
Right. And what I can hear you saying is so important. Earlier I spoke abstractly about managing high-risk situations. You've given us a great concrete example here. When you go out with friends to a restaurant, you have to be one step ahead and have a roadmap for how you're going to handle that alcohol-related situation. And I think what you're saying is restaurants could be more supportive of that by creating visible options, and I definitely agree with that.
Renee Ross, what do you think of that?
I love it. I love it. I think that what she's doing is really working to change the culture in a lot of ways, and say thank you for your work around this. I drank a lot of Shirley Temples in the last 6 years, and that is what I see that doing. You are changing that culture, because as the doctor said, it is our culture that is actually really, really challenging in a lot of ways, right? Out here on the East Coast, the culture of drinking and the kitchen party, and how much of a drive or alcohol is to the local and provincial economies. I also want to underscore as well how great it is that she's got this Facebook group, and that so much of this is happening online. So when I quit, and now as I maintain my sobriety, I'm in a rural area, right? So there's really limited access here to, just in generally, even before the pandemic, we have very limited access to supports and stuff. I am not a wealthy woman, right? So I can't go and get the therapy and these services that other folks might be able to afford. so I have to build that, as the doctor was saying. I had to build that roadmap, right? And I still do, and I have this toolbox that I have with me and I carry with me every day. And these groups, these Facebook groups, these online groups, I think that they've been essential for me, and that they're going to be so crucial for folks who need support. I'm thinking of another group right now. They're called Unintoxicated Queers. It is a group that they're both in person, but now they're moving online, and they're a support group for LGBT folks in the province. I also want to mention as well to our listeners that if you go to www.mhahelpns.ca, so basically that's Mental Health and Addictions Nova Scotia, they do have a list there of a bunch of different resources, and it's all parsed out by what part of the community that you're in. It includes AA, it includes these different Facebook groups. There might also be groups in your community. Our local church here in Amherst is doing a recovery group, because AA may be great for some people and it might not be for others. And I also want to quickly acknowledge the family members and the friends of alcoholics and of people that are struggling through this, and to know that there is help and support for them as well. We cannot forget the family members of folks and all that they are doing in providing support and holding space throughout this. So there are Al-Anon and Al-Anon teens and all of these resources for them.
Well, and I should mention for listeners in PEI New Brunswick too, if you search addiction services online, you'll come up with phone numbers if you're looking for some help on all of this as well. So that's important as well. We're out of time. Renee, thank you very much for joining us today. We appreciate your time very much.
Thank you, Bob. Thank you, everybody.
And Leanne, thank you for your time as well. We appreciate your call today as well.
No problem at all. Have a great day.
Okay. And finally, Dr. Sherry, thank you for your insights on this as well. We'll talk again soon, I hope.
I enjoyed our conversation. Thank you, Bob.
All right. Dr. Simon Sherry is a clinical psychologist in Halifax, also a professor in the Department of Psychology and Neuroscience at Dalhousie University. Renee Ross, living in the Cumberland County area in Nova Scotia, has been sober for 6 years. And Leanne Richardson, head of Sober City in Halifax, an online site that encourages conversations with people who are maintaining or trying to maintain their sobriety. We'd love to hear your thoughts on this. If you'd like to get in touch about anything you hear on the show, 1-800-565-5463 is the number to call, and our email is marnoon@cbc.ca. Well, tomorrow on the program, Holiday Giving and the Pandemic, money coach Judith Kane will be here and telling us how we can do it without breaking the bank. Just a general conversation about money management during these times. I'm Bob Murphy. Thanks for listening to Maritime Noon. Have a great afternoon.